So we provide 3,200 and 3,300 shillings to every learner and those with special needs in schools. And this money is sent to the schools for management by the school boards. I will also talk about the workforce. Currently, we have 871 teachers. This year alone, we have employed 498 ECD teachers. And our teacher-pupil ratio now stands at 1:35. We have a feeding program, which is complemented by free milk. We provide 2 packets per learner in every week. And all the learners in the schools get feeding. We're also starting new schools. Like this year, we started 3 schools, new schools. And you know the problem of land. So every time we get an opportunity to secure land, we are starting new schools. We have schools in Kamulu, Jiru, and Jemike. I'm waiting for the slide.
You just go on, please. Yeah, just go on.
Go to the third one. In financial year 2020-2021, we gave 80 million to all the schools for facelift. What I was talking about is an opportunity to check on the feeding program. And now I'm talking about this, to do a facelift of all the schools in preschools in the city. And you can see this is a block of an ECD center in a place called AF Ruben in Mukuru Kwanjenga slums. That is the stage of the ablution block in a school in Ruai called Gituamba. We have also partnered with many groups. Like we have a group called Kiwash. We have partnered with them to improve our ablution blocks in schools. So this is New Njiru. A toilet block was done. We have Maoa Preschool. We have Dr. Mukiora in Dagoretti and Shieko in Kasarani. COVID-19 response. Virtually all the schools, we responded positively. We are providing washing facilities. We have provided water. These are some of the few examples. Then that is the provision of hand washing materials. You can check on next. And all the schools, we partnered with UNICEF and the ECD network. Then this year alone, we have procured, roll the slide, over 4,000 chairs and over 1,000 trapezium tables to all the learners in the schools. Yeah, we move with the slide. Yeah, these are the wash materials with UNICEF and ECD network. The next, this is the furniture I'm talking about. Sorry. Just next. Yeah, for all the schools. That is a school in the Great North called Lady North. That one is Langata West Center. That one is Kasarani, Kiro, with the new furniture. Next, the physical development. The sector has committed to build 10 schools every year, new ones. And the next slide, I will show some of the schools that we have done in the last financial year.
Thank you.
So we have one in Molem, we have another one in Kongoni, another one in... Yeah, and then just to mention, we have partnered with Save the Children to develop some of the schools. That is a school in Kiboro, another one in Madare. And child care facilities, we have partnered with Uthabiti to operationalize the Child Care Facilities Act that we have. And then I will not forget to mention the bursary program, which does not really touch on the...
Thank you so much. Give them a round of applause. Thank you so much. Pusia, please come.
Thank you.
Let us take 5 minutes, please. And also you look at Mugo is seated behind me. When she shows you the paper showing 2 minutes, see the main important things that you can touch on. And then you share with us the presentation to the secretariat, please, so that it goes to the report, to the conference report. Okay?
Thank you. I'm called Robert Emoru. I'm the Deputy Director, ECDE, Busia County. I came along with an ECD officer, Madam Jenna Dongo, one of our ECD officers in Busia County. I'll be very brief. In Busia County, we have a total of 456 ECDE centers with an enrollment of around 56,000 so far. Coming to the human resource teachers, so far we have employed 439 teachers on permanent and pensionable terms, that is job group G and H, for certificate and diploma holders respectively, and they are on the scheme of service. Then we have 555 teachers whom we have employed on contract, and through his will, the governor, we have planned to put them on P&P by the end of their contract next year, May. So we shall be having around 984. We have a total of 984 teachers employed by the county government so far. We have also done something on furniture. We have procured and delivered around 15,000 plastic chairs, which are appropriate to the age level of the children in our schools. We have also procured and delivered teaching learning materials. We have ensured that every public school has a curriculum design for PP1 and PP2. And then we have bought also textbooks as per all the activity learning areas in our public schools. We have, in collaboration with the Ministry of Health National Government and the Department of Health in the county government, we have always been doing deworming programs for ECD children. Even this year we did deworming for our ECD children, and we have also done vitamin A supplementation in collaboration with those health partners. We have also constructed classrooms. We are not able to come with the slides here. We have constructed complete 263 classrooms. They are complete and in use. We have 85 ongoing. The constructions are ongoing. And we have proposed that in the remaining schools, we shall be constructing a classroom and a toilet with tiles and ceiling boards for the ECDE children. Otherwise, we have also an act, a pre-primary act for the county that has been assented to by the governor, waiting implementation. And in that act, we have enacted that we shall have a feeding program in every school once it comes in implementation. And then we shall have to support the ECD centers with capitation funds as soon as the act will be implemented. Thank you very much.
Thank you so much. I wish everybody will do like they have done. And I want to also say, you know, we invited the health and education, and we want to hear, in terms of the health indicators, what is happening in your county. The head is here. She would also want to know what is happening on health. So those of us who are coming, please also tell us what is happening on health. So now we move to Turkana. 5 minutes, please.
Good afternoon, everybody. My name is Makada David, Acting Deputy Director, ECD. Briefly, I will give you the statistics. We have 137,560 ECD children enrolled in our ECD centers, with the 570 ECD teachers, 214 men, and 356 females, all trained and employed depending on their grades. I think Turkana is one of the counties that follows SRSC, and if you are a certificate, you are given the scale according to certificate. We have employed up to the graduate job group K. We have 6 sub-county education officers to oversee the supervision of ECD programs with one director acting deputy. On infrastructure development, we have a total of 937 public ECD centers and 7 private, a total of 994. Recently, or since the revolution started, we have constructed 230 model ECD centers with all furnitures well furnished across 30 wards. Turkana County provides a comprehensive feeding program to all public ECD centers. In fact, this year alone, we had put in a budget of 150 million. We supply them with rice, corn, soy porridge, beans, cooking oil, and iodized table salt. We have also, in terms of quality assurance, we have assured that our ECD teachers are CBC compliant, and we have trained all of them with support of UNICEF, both the refugees and the host community ECD centers. We have gone a step again to train the BOMs in standalone ECDs and even with those within the primary. At the same time, we have also, after undergoing the training at these conferences, we also started implementing some programs on nurturing care, whereby we work together on an integrated approach where the health sector plays a key role. We have our normal stakeholders meeting that discusses all issues, and as we talk, we came from implementing some of these projects. The Ministry of Health, the register of birth and death, to ensure that our children get the birth certificate as early, the community health workers work together, the ECD center becomes a center where children are reached with all services that are required.
1 minute remaining.
Thank you. We are also developing a ECD, what we call a framework that will be helping us address some of our unique problems. Our key partners are UNICEF, Kenya, Mary's Meal, Save the Children, and the Feed the Children. Indeed, our partners have come in and are really embracing the nurturing care framework, whereby everybody is happy. And I think from this, that's why we are here. We had a lot of activities, but we squeezed ourselves to ensure that. Thank you. We shall share a slide. God bless you.
Thank you. I think now we are catching up. I want people who are brief like Turkana and Pusia. So the next presenter is Migori. Migori. Good. 5 minutes, sir. And also talk about health also, what you are doing in terms of health.
I'm Lazarus Ukutu, Director Education, Migori County Government. I will acknowledge my chief officer. We travel with her, Madam Mary Medita. We had a team also from the national government, Madam Batia. We collaboratively work together. Then the health team also attended this meeting. Dr. Tom is okay. Migori is there as a team. So in Migori County, that narration is that what the devolution gave us. And then we cited that we got 5 major components that we consider while delivering this quality education to this institution. Then push slide. Are we moving? It's my phone. It has come. Yes, the current statistics, what we have in Migori ECD, we have around 630 public schools. Teachers, we have around 978. Then we have a population of 103,978. Then we need a deficit. We have employed teachers as a county government, around 673. We have that deficit. Those teachers are in contract. They have not been put in PNP. We are struggling as a department so that we can engage them in permanent and pensionable terms. Slide. My time, please. Then the components are primary health and nutrition, which we actually collaborate much with the health departments, and they have done a lot in training of which Luala community presented in that other group. A lot they have done. Then we have training of those teachers in CBC, the curriculum. So in this, we have implemented these components with the WASH program, deworming of those ECD children, provision of vitamin A supplements, partnership with the health department, immunization of this ECD pupils, and school feeding program. And I want to mention that in a school feeding program, it is community-based in a way. As a county government, we only support, but there is UGI provision in various ECD centers. Then we also partner with water department to provide water tanks to those ECD. Then just continue. We've also constructed a number of ECD classrooms through labor-based. We tried the contracting and it was not working for us. So we usually send around 500,000 to schools, and then we entice, we actually involve the community there. That's the board of management to do as this construction. And several of them, can you take me to some the slide of the ECD classrooms? Several ECD classrooms has been done, and it delivered around 400 and around 430 something. On training, actually I've said that you have trained teachers on CBC once. We are preparing again to train them so that they can be acquainted with the skills and the norms of this competency-based curriculum. Slide. That is distribution. That's training of those ECD teachers, I think. This one I've talked about. Just another slide. curriculum implementation, the county has sub-county education officers who are in charge of those sub-counties. We have 8 sub-counties. Then they supervise on curriculum, quality and standard assessment, classroom observation, material development, and the management at that level of sub-county. Number 4, we also do procure other infrastructures like the chairs. We procured some chairs, and in that slide we are distributing and flagging of those chairs and tables. Continue. That's together with the beds.
Thank you.
I wanted you to see the classroom that we have done. Can we show them the community mobilization? We do parental together with our health departments.
Thank you. Give them a round of applause.
So those are the classrooms.
Yeah, all these
Actually,
reports we are going to
thank you.
to have them, and we will share in the conference report so that you can be able to read what the other counties are doing in comparison with what you are doing, and that is great. Our next presenter is Embu. And I just want to remind that when we are speaking about pre-primary, what we are doing, let us also talk about children's health, their nutrition, and the like, so that we know how it's happening.
Thank you. Hello, thank you. I think first I will recognize the team I have from Embu. I have my CEC, John Kiamati from Embu. I also have my colleague Director Ken Vocational. Siwapigiwe makofi. So my name is Jeremiah Ireri. I'm the director in charge of Ecd from Embu County. Embu is in the mountain region. So those who are looking for the route to the mountain can see me after this. That is on a right note. I'm also a product of Kenyatta University, but why I say? So thank you. So in Embu, when devolution came, we started with a baseline survey in 2013 that informed the policy direction and the structures that we have in the county. From that baseline survey, the first thing that we did as a county was the issue of human resource. We were able to employ 484 teachers immediately. That was in 2014, January, whom we engaged on contract for 2 years, then absorbed them on PNP. So this year we are adding another 100 because our enrollment teacher people ratio is still high. We are at 1 to 39. Now on policy issues, we did our Embu County ECD Act in 2015 that established the Department of ECD. We also did the Child Care Facilities Act 2016 that we are still struggling to ensure that we implement, especially on the issue of child care, daycare centers for children under 1 to 3 years. That's still a challenge to us, especially the mushrooming of them. On issues to do with access, we have increased our access from a GER ratio of 47% in 2014 to the current 71. I know we are still 6 points below the national one, but we are trying. So what we've done on that is infrastructure. We have done 224 classes. We also have ensured that we have established what you're calling feeder centers. These are in areas where we have densely populated urban centers, and also in the rural areas, especially where children were walking for distances of more than 2 kilometers to school. So then we have our feeding program. We are doing milk for our children 3 days a week, 200 ml packet. We have also mobilized communities on school feeding. We have piloted for a county feeding program in one ward, which once we are through, then we'll probably roll it over to the county. Issues of capacity building, we are implementing CBC. We have been able to train our teachers. We are partnering with a number of stakeholders. Like we were doing training on assessment with Kindergarten Expert International. I can see more here. And also Moran Publishers. We call curriculum. That's something that we are doing. Probably that in other counties. We have been able to send our children in national music festivals and drama music festivals. We are the champions of 2019. That's the last time we had national festivals. So our children in ECD were able to take 2 teams that won national level, and were able to participate in the Gara Night in Nakuru and also entertain the president. Lastly, on research, we are doing something with the Embu University. We did a proposal, and we already got a grant for 5 years with Fairfield Spencer Foundation on a project on parental engagement in ECD centers. So that's a component we are doing with Embu University that we are rolling out within the next 2 months. That will take training of teachers on those components. So a few issues, probably before I leave, on the challenges that we are experiencing in the counties. One of them, of course, is capitation of the children. We are still struggling with budgets. And probably what I would recommend to this conference is that next time, let's also engage our elected readers, especially the MCAs, because we have a challenge on having child-friendly budgets. So we need probably to think of a way engaging them, because these are the people that hold the purse. So the other issue is on health. We developed our SYNAP for 2018-2022. We are working with the Department of Health. Then lastly, probably on this conference is the gap that we have, especially on under 3 years. Counties, we are still struggling to find a way, because CBC has recognized for 5 years. Under 3 years, we are still struggling. We would also want to find out what other counties are doing in terms of that area. Thank you.
Thank you, Ireli, for keeping time and sharing with us what Embu is doing in terms of early childhood. I now want to have Moranga come and present. Moranga, are you here? Okay, Moranga is not there. Let us have Homa Bay. Homa Bay? Okay, after Homa Bay, Siaya will present. If we keep time, we can have at least 2 or 3 more present before we break, because we started late.
Thank you very much. I'm Scarfield Manyala, Director in charge of ECD Homa Bay County. Let me take this chance to tell you that we are serving the children in Homa Bay County, and we are serving children of 83,765 current data. We have 881 public centers and 4 standalone ECD centers. We have managed to employ 1,352 teachers under contract, and 410 certificate holders, 847 diploma holders, and 95 degree holders. We have 8 sub-county directors who help us manage matters related to ECD, and we have also 40 ward supervisors who support that. Areas of score. Homa Bay County has successfully scored in inclusive education. This is championed by site savers. I'm happy one of us, Dr. Professor, I call him that way, Charles Odol is around, and UNICEF, who also gave us the dream, and we are working on it to see that we have inclusive education, and working together with the Director in charge of Person Living Disability, Homa Bay County. We also have positive parenting. This was a dream that was started with Plan International, and we faded. We have not let it die for continuity purposes, and with this was a dream of people like Patrick Moth. Thank you very much with your team. We also have nutrition. We have approached this through partners who discovered the importance of sweet potato that is found in Homa Bay. Together with the parents, we are now doing nutrition through feeding program, and that positive parenting has birthed inclusiveness in them providing for children uji or porridge in school. We have a very good working environment with our partners in inclusive health approach. This was championed by UNICEF too, that made us have a friendly learning environment and also good connection with our health officers so that we can have this one done. And at the same time, we have had Vestergaard, who has championed towards safe drinking water. And also, we have had CBC training. We have scored there with working with our partners effectively, I also want to say that there are challenges. Schemes of serving challenges, that's why we are still having contract, policy issues, and political misplaced budgeting ideas, where they take money to other places and leave ECD, the core mandate. May God bless you.
I didn't give him a warning, and he has been able to tell us what is happening in Homa Bay. Thank you so much, sir. I now want to invite the host, Siaya County, our CEC, Madam Rosnell, take us through what Siaya is doing.
Okay, I didn't have the magic touch. In Siaya, most of what we have in Siaya was mentioned yesterday by the CC Health. However, and also His Excellency also covered a bit of it. I'll just touch on a few. I do not have any write-up, so I'll just talk through it. We have 611 ECD teachers, and among the 611, we have some special teachers who teach our PWD schools. We have 4 institutions that cater for the blind, the deaf, the physically challenged. We have 684 public institutions, ECD centers. All our daycare centers in Siaya are private. So we are thinking of working on regulations to manage them because they are business entities, but we need to have regulations governing around them. We work closely with the Department of Health and Agriculture. All our CHVs do our monitoring for our children and immunize them, deworm them. And then we also get our data as education team from our health department. So we have to work together as a team. We have constructed 348 ECD centers of the 611 that are available and furnished 178 of them. We are updating our ECD Act to be in line with the ECD Act 2021. And we are still working on rolling out our feeding program. So far, 2 wards are fully funded, but we are still working on rolling out for all the remaining 28 wards. We are recruiting 200 ECD instructors. We are working on implementing the scheme of service. However, our constraints right now are the wage bill limits. We are above 35%, which is putting a handicap on the county. The standalone ECDs were furnished with all COVID-19 preventive measures. They were given hand washing machine stations, they were given tanks, and they were given thermoguns, etc. Under the Department of Health, we have put in place a 5-year strategic plan on nurturing care for ECD. That is already happening, and as Waziri Health yesterday talked about it, it's already been passed by Cabinet. Community health strategies are in place to enhance ECDs. Multi-sectoral approach or model is what we are using to partner with our stakeholders in the nurturing framework. By the last survey in 2019, multi-indicators survey, we were at 22% of stunted growth and 67% in exclusive breastfeeding. As I mentioned, our CHVs have all been trained on nurturing care, and the basic model for CHV training has been implemented. All our CHVs are paid a stipend of 3,000 per month, and they are all NHIF covered, them and their families. We are bringing on board the national government on the child protection bit. We work together with the national government on issues to do with violence, so we do a lot with the national governments and our partners. And then finally, through the Smart Start CI initiative, we have teamed up as executive and worked together as a committee along with the stakeholders so that the government can be able to own the nurturing care framework. So the Department of Education, the Department of Health, the Department of Governance, and the Department of Agriculture are all members of the team. Our partners, Hilton Foundation, PATH, Childcare, KMET, UNICEF, just to name a few, are our backbone. Thank you very much.
Thank you so much, CEC Education. I think we didn't give him a warning. I want to say that listening to what is happening in every county that has spoken, a lot is happening in early childhood, but that seems not to be enough, that we need to move further than we have done. It reminds me when I was a preschool teacher, I longed for a day when I will be employed by government. But for 13 years, I was a preschool teacher trained in Trans Nzoia Disese. I never got to be employed, but instead God opened a way for me to pursue education. So even the things I believe in and I push for are things that I wanted to be given when I was a preschool teacher and I did not get them. They are coming out from your presentation. And I must thank you so, so much. I'm being pushed by the master of ceremony who is telling me we have to stop here. Tomorrow we have another 40 minutes. Today we have been able to do, I think, around 8. And from the list, we are remaining with around 9. So tomorrow we are going to have a session like this for those counties who did not present, we will present. Please make sure the talking notes that you used, if you can reorganize them and send it to the secretariat, or if you can plug those papers and give those seated up there, Rachel and Regina seated there, they will be able to capture what your county is doing. So thank you so much. I want to give this to the master of ceremony to direct us how to move forward. Thank you.
Let us appreciate Madam in a better way. She has done a good job, sio? Sasa tutamu-appreciate kwa njia ambayo inaonyesha kwamba tumekubali. Of course we will do this and then we bring down that. Hiyo makofi itakuja chini kabisa. Sasa haya pamoja, the sign language way, and then bring it down. Thank you very much, Dr. Mwama, for leading us through that session. And the counties, as we have heard from your various sectors, I was glad to hear one county say, we would like to know. That liking to know is what we are actually all about in this place. So let's pick notes from each other. And Embu, talk to Madam Rosnell. She will tell you how it is done. The MCAs and how it is they have been brought on board, she will mention to you that, how it was done here. What I would like to mention is one thing. I've had here a conversation around daycares. And I think I just want to pose this to this team here. In terms of the right phrasing of what we are doing. Daycare centers. Who needs care? Does the day need care or is it the child? If we get it right, in terms of how we name, we will move the needle again. Daycares are not what we talk about. Even the Constitution devolved child care services. Let us focus on the child. When you call them daycare centers, do we have night care centers? We have night care centers. So is it the night being cared for? Let's focus on the child. Bring back the child to the center. And let's have a conversation around that so that we avoid the situation where Deputy Commissioner was saying, you come and put up a structure for me, the hardware, and then say you have built a daycare center. We need to be able to understand that the software is what will inform whether we need that hardware. Something to think about over lunch. Lunch is served in the same place we had it yesterday. We will go for 45 minutes. Today it is better. We apologize yesterday that there was a problem with the service. So we will do lunch. It is now 1:15. By 2 o'clock, we'll be back here. We have an afternoon session led by an online group that will take us for about 40 minutes. And then we go into the last breakout sessions. And so we are going to have the entire team that is here today walking back to the same area where we had our lunch. 45 minutes lunch, we come back for an online session for 40 minutes, and then after that online session, our breakout session will begin, and we will end the day by 3:30, as is promised in the program. So I would like to request that we stand, get a word of prayer for the meal that we are going to have. Let me ask CEO Owadi to come and lead us in this prayer, because we've not heard your voice, and you can actually use the mic there, or yeah. Atuombee ili tupate chakula. Tafadhali tutulie kwanza. Tutulie kidogo tupate maombi ya chakula.
Okay, thank you. Let's pray. Father, in the name of Jesus, we want to appreciate and thank you this afternoon, Lord. You've been with us since morning, and our program has run smoothly. Lord, we are breaking for lunch, and how we ask you that you may sanctify and bless that food as we partake it, Lord, to give us the strength that we need as human beings. We thank you, and we ask you to be with us in the next session in the afternoon. We pray this believing and trusting in Jesus' name.
I request those of us, the CECs who are present, to join Dr. Mwoma, the CECs and the directors who are here. Please join Dr. Mwoma, and we will lead you where to go. And the chief officers who are here, chief officers, CECs, please remain here. We have Dr. Mwoma taking you somewhere for lunch. And the director.
The Nurturing Care for ECD program is actually, we are the implementer for the Eastern African region, from Zambia to Ethiopia, Tanzania to Mozambique. We are actually the ones who are implementing it. This program was actually, it was launched back in Harvard, where His Excellency the Governor himself went there, made a visit with the team from the county, and actually this baton of the Nurturing Care was handed over to him, and then he promised to come back to Siaya County and implement it for also all the neighboring counties. So we are actually the county modeling it for Siaya and for Kenya as a whole, and for the whole of the Eastern African region. Initially, back in 2014, according to the Kenya Demographic Health Survey, it was found that there was high level of malnutrition. Issues like malnutrition, we call it stunting growth, low birth weight were very prominent because of probably issues to do with nutrition, poor visits to the health medical attention, and then poor, we call it responsive caregiving. It was not up to date. So when now the Nurturing Care program came with the 5 elements, that is good health care, good nutrition, security and safety, responsive caregiving, and opportunity for early learning. Now we are seeing that from the campaign that we have been doing, the parental engagement, the so many workshops, and then the which we have been doing in a multi-sectoral nature, whereby we involve every sector, from the devolved to non-devolved. We are moving together as a unit in ensuring that this program is implemented.
Siaya County has about 1,000 ECD centers. Now our ECD centers are vast across the county. We have both private ECD centers and we have public ECD centers. Of the 1,041 ECD centers, we have 684 ECD centers that are public. When we come to ECD, we don't look at the education itself, because at this point I am talking about early childhood development in terms of learning, which is the 4-year-old to the 6-year-old. However, when we look at ECD, we look at it as holistic as it can be. A child's development starts from conception to 8 years old. This is the place where the brain of the child develops, and the way the brain will develop will affect the way the child is going to grow up in the future. Now, your child should be looked at in those eyes, because your child is your future. How do you take care of your future? You protect it. So those are the strategies that have been laid out under Nyathi and Mwandu, so that this child will be brought up in a holistic kind of way. Nyathi and Mwandu is the rallying call. It's in Doluo. That means a child is wealth. If you give that child a good foundation, that child is wealth. And so, being the patron of Smart Start Siaya, I've been a patron for 2 years, following realization and the introduction from the county executives who went to Harvard University for a program on early childhood development. And from Harvard University, when they came back, they realized that early childhood development is very critical in development. And if we invest more on early childhood, then the return on investment is very high. And so we realize that mostly, even us as parents, governments, we don't really take much interest when our children are young. And so we lose a lot, because that is the time a child develops very fast, the brain of the child develops very fast.
This project of Score ECD is looking at a child at 1,000 days. 1,000 days means from conception to 2 years. And we look at many things around these 1,000 days. We are looking at the health of the mother during pregnancy and after pregnancy, and then during the 2 years, how is the mother. Then we are also journeying with the child and assessing the milestones of the child. The milestone of the child, we are looking at so many things, health-wise, nutrition, education, the formation of the brain, how does a child react to the environment. Along that, we are also looking at the immunization of the child. How is the child's health going to be taken care within the 2 years? We look, the child has to go through all the immunization, and this helps the child to remain healthy.
Male partners, we really train them to say that a mother cannot raise a child alone. They have to be two. So there's that responsibility of a father in the house. So fathers, we see them coming to the clinic. They bring their wives to the clinic, their children to the clinic. Whether the mother is pregnant or not pregnant, they come with the mother in the clinic. So it's a habit that they have really developed, and they are coming frequently for that, and they feel it's just too good for them. If a father is not able to escort the mother to the clinic, a father will provide transport. And the father also is taking a responsibility of reminding the mother, your time has reached. Did you go to the clinic? And then when it comes to nutrition also will try detailing them and also training them to provide. That is by initiating the kitchen garden around them.
Uzuri nilikuwa nafundishwa hizi vitu na naenda kuambia babake. At first alikuwa anaona ngumi. Sa the more niliendelea kumwambia ndiye akaanza kupractice. Na the difference is there. I've learned things that all things is not about money. How can I find a balance there? They introduce us to kitchen garden. So the kitchen garden we can unaeka sukuma wiki, spinach, even kunde, such things. So the little money you have, even if it is 50 shillings, you can go and buy your mena. Then you take sukuma from the shamba. Then you cook with ugali. So the child has balanced diet. Kuna ugali, which is carbohydrates, kuna sukuma which is the vitamins, na kuna omena which is the protein.
I have learned that upbringing of a child should not be left to a woman alone. For you to have your children growing the right way on the positive direction, the child that requires, that gets everything that you need in life, you, the man and the wife, must work together. Now, as a man, what should I do? I should provide to the children. I should help my wife to perform the domestic chores, like cleaning the child should not be left with the woman alone. I also play with my children when I'm around. Play is something very important in that we learn that when you play with the child tends to know you better. The child psychomotor system of it can grow. The child comes out when he or she is a very strong person. Intellectual development can also be realized when you play with your child. And during play, we don't need to go to the shop to buy the play materials. We make them with the local available materials. We improvise. We find that it is very expensive, and the money that we will use to buy some other things that we use in the house, we waste them in buying these items. Why don't we use the local available materials to make dolls like this? We have made so many of them, and while you are making, you find that the child also enjoys following what you are doing.
We have so many materials that you can see. We have hung others around. We have a play box which we make rockery that we provide every morning. Once a child gets in, he is free to pick. We ask the mother to pick the toys and try to engage with CHVs again to play with them around. We train them that we are supposed also to make toys to our young ones at home, and this chart, there is some days we had so many charts that we are able even to give to the communities, household communities, that they can able also to monitor those ECD activities at the household. ECD activities which are being promoted by that organization, that is BATH, it has encouraged many mothers to come to our facility because they guide us what we are supposed to do. They have taken us to courses, some trainings, and their routine. They come to this facility routinely to check how ECD activities are being going on. These activities of ECD starts from the community. They have also trained our CHVs on ECD activities. They can also able to refer to us, the hospital, also in CH department, whereby we examine the child according to developmental milestone. Then we refer accordingly if the child has not achieved according to the age.
Sasa wakina mama huwa tunawatembelea, ni wewe mwenyewe ujipange. Kama mimi mwenyewe najipanga at least in a month, mama namtembelea mara 2 mara 3. Sasa vile ninaenda na book appointment, manake wajua wako na kazi wanafanya. Hiyo tarehe ambayo amekuja na prepare topic ambayo tunaenda kuongea naye. Tuko na 17 topics ambazo tunacover. Kuna introduction to child caregiving, kuna secure attachment, kuna child development, kuna the importance of play, appropriate play for children and caregivers, inclusive caregiving, making toys from local materials, kuna under communication, kuna the importance of communication, play and responsive caregiving. Under health, kuna safe pregnancy and delivery, kuna basic newborn and young child health, kuna malaria awareness, HIV and AIDS awareness. Under nutrition, tunaongea about breastfeeding and complementary feeding, balanced diet. Under protection, tunaongea about safe home environment and wash. Alafu topic ya mwisho ni positive discipline.
Things like malnutrition has gone down, stunting has gone down, child mortality rate has gone down, the issues like mobility and the rest have gone down. Right now, a number of mothers are now delivering in health centers. Before this program came, actually a number of them were being catered for by their midwives, which was actually leading to a lot of child deaths.
Nikiwa pregnant, nilikuwa nafunzwa jinsi ya kuongea na mtoto. Unashika tumbo lako, unasikia penye akilalia huku, yani utasikia mtoto akicheza. Mtoto saa zile kwa tumbo anajua sauti ya baba au ya mama. Saa zile baba anaguza tumbo yako, anajua. Pia alikuwa na kiss tumbo yangu, nasikia sasa pia mama anasikia vizuri, mtoto pia anasikia vizuri. Mtoto hakuwa na ugonjwa yote vile nilimzaa. Mtoto alikuwa active sana.
What we first did was to bring partners together, all partners who are working with children, and also departments that are relevant in children's growth and development, and that is health department, education department, agriculture department, and also in areas of lands and roads. And maybe you'll ask me why at some particular point in time, but we realize that, a child really, some of the planning and even the programs that we have, the way we plan our cities, these days most of the playgrounds were grabbed. We don't have spaces for children to play, even when we are planning buildings and, areas, we don't think of children. Even in schools, when you have nursery schools, you find that a toilet for children is taken very far away, and a young child, when wants to go to the toilet, goes when he or she is very pressed at that particular point in time. How do we really take cognizance that when we are planning, because these are voiceless children, they cannot voice that we want this. Youth can say we want this, women, yes, and we concentrate more of our finances on women and youth, and we forget our children. We are trying as a county to recruit more ECD teachers. We are trying as a county to capacity build the caregivers. That's also another challenge where we are in. Our partners are really helping us, especially on the part of capacity building for caregivers, in the line that early childhood is a transitional phase. 0 to 3 years, you find that most of the working parents have children who are 2 to 3 years, and they have to go back to work. So they have to give these children to a caregiver. Caregiver is in the child care centers. Once you notice that a caregiver has been built their capacity, that means you're sure the vaccinations of the children has been done. That means you're sure the growth of the child has been measured. That means you're sure this child who's transitioning from 3 years to ECD center now at 4 years is a child who is simply being monitored, has been dewormed from the very beginning. So by the time they come to the ECD center, the teachers, the instructors in the ECD centers are ready for this child. They're able to handle the cognitive development of the child. They're able to handle the curriculum that is in place, and they're able to nurture this child for the next phase.
The county government have provided us with classes. We have desks and chairs. After we have been trained, so we come to the ground, then we can ask children to bring this locally available material, then we can make some project with them. As an ECD teacher, we value our learners very much. So when they are here in school, we teach them more about good behavior, good manners, and how to relate to others.
If science says that early childhood is critical, 80% of brain development occurs from 0 to 3 years, then the 20% really it's just what takes on in environment. And if you can imagine, if we lose that 80%, we are not saving the brains of our children. As much as we are putting in place the structures, we would like community to accept that these are our children, and so that they don't hide the children at home. Now, why do I talk about this? I talk about this in the line of the persons with disability. Children who have persons with who have disability in one way or another, the parents feel like they lack something. They could feel, one, they're stigmatized. Two, they really don't have the capacity to be able to take this child to school. So they lock them in their houses. So this becomes a challenge for the county to be able to bring up these children in a universal way.
One of the loopholes in the sub-county and the counties and the national government is like you realize that when you want to sign a policy, it cannot be signed at the county level. It needs to be signed at a national level. And sometimes it's like people do not understand when we talk about that we have these children under 1,000 days, and we need to put a policy in place that will help them. It will take you time to explain, and you'll move with those officers several times at the national level. At the county level, it becomes easy because it's almost at the grassroots. People need to be brought to read on the same script. Who are these children under 1,000 days? Can people understand? If I say we are taking care of the children over 1,000 days, what is included in these children?
The only way we can create enabling environment for research in ECD is ensuring that there are resources.
When we get resources at the national county offices, it is not very easy for these resources to trickle down.
The county's reps should be fully enjoined in the development of these policies. Any policy being developed, whether it is in agriculture, whether it is in education, it should involve representatives from the county level.
ECD is a multi-sectoral issue and has to be looked at as multi-sectoral. Where do they get their water? Where do they get their food? Where do they get their health requirements? It has to be multi-sectoral.
The government to take cognizance. Those officers who are working, doing planning and budgeting, to realize that when they are budgeting and doing anything, they think of children. And so we are also trying, when we go out to the community, is to help them create demand so that they demand for these services.
Now we need to go to the next level. The next level is to identify the gaps that are in each school, so that you know that the school that you have identified, it really is not just masks and sanitary towels and sanitizers. It is now deeper. And deeper means now we need to know how to support them in other small issues that they need support in.
This conference is a unique opportunity that happens once every 2 years, in which a large number of Kenyans and international participants from all areas, all stakeholders, will be coming together in order to discuss these extremely important issues. These issues have been have become even more important in the context of COVID-19. So this fourth international conference, which is taking place 19 months into the COVID-19 outbreak, with all of the lessons learned from the COVID-19 outbreak, is an opportunity to share those learnings, to make sure that everybody are aware regarding the importance of ECD. ECD is a relatively new area of work in many countries, which until recently did not enjoy the same level of knowledge and awareness and publicity as many other areas in public health. It is now that we are learning with experiences from many countries, and Kenya included, regarding the importance of nurturing care framework, the importance of early childhood development, and that is a time for all of us to come together and to make sure that we really prioritize those nurturing care framework investments in order to ensure that Kenyan children get the best in line with all of the international standards, to make sure that they succeed in life, that they fulfill their potential, and that themselves as individuals, their families, their communities, and the country as a whole benefits from those interventions.
This year's conference is important because we are focusing on the children who are below 3 years, with a special focus on their caregiving, because in Kenya you will realize that when it comes to legal and policy framework, we do not have guidelines that are showing how we should look after the very young children, especially for those mothers who are working and where they leave their children. And it is an opportunity for us also to explore children in diverse circumstances, including those in the refugee camps, those who are accompanying their mothers to prisons. They have not done any crime, but they are accompanying their mothers because they are young and they cannot be left in their community. All this will be discussed during the conference, and we anticipate to come up with resolutions that will enable our government come up with policies around these children and even legal frameworks that can protect these children in society.
Lola is a community organization, so it started by the community themselves, organizing themselves, so that they could start an hospital that could help their community members, because people were walking long distances before they could get services.
Globally, we have over 250 million children who fail to reach their age-appropriate milestones.
According to UNICEF, over 200 million children globally fail to reach their developmental potential in the first 5 years of life due to poverty, nutrition deficiencies, poor health, and psychosocial services.
Nurturing care opuonjo wa ni mondo mi wariure e tich kanyakla mondo mi dongo mar nyathi obed makare.
We have nurturing care framework incorporated in the community health strategy, so it becomes easy to then incorporate this as a package that community health workers are delivering on top of what they have been delivering on a day-to-day basis. So last year there was the launch of the new community health strategy and also policy. So inside there is nurturing care as some of the services delivered at household level by community health workers. So that gives us a very, very good opportunity to then now scale up the work with community health workers in delivering nurturing care at the household level.
World Bank records that many countries invest more in children when they are older, yet research shows that the returns on investment are more substantial in children during their earlier years.
ECD has strengthened maternal and child health.
The nurturing care components, there are 5. Okay, we have good health, we have adequate nutrition, we also have nurturing and care. 4th one is we have safety and security. And then finally we have opportunity for early learning, where we measure on play. Yeah, we always encourage them to let the children play, because play develops so many things in a child.
Through its community-led health model, Lola Community Alliance aims to build the capacity of rural communities to advance their own comprehensive well-being. It is within this model that Lola implements a robust ECD program based on WHO's Nurturing Care Framework.
The ECD program, when it started, I've gone to training twice. We have the first one was the introduction into the ECD. Then we had another one on toy making.
In the last year, Lola incorporated nurturing care components and care for child development into its community health services to further improve health outcomes for young children.
I've been taught on the maternal and child health, the ECD one, the sexual reproductive health, and even the COVID-19 as a respondent CHW. And this one has also helped us, because whenever I have the knowledge, I disseminate to the community members. This one has helped a great deal, and our lives have improved.
Each month, community health workers conduct integrated parenting sessions where caregivers of children between the ages of 0 to 4 years receive parenting education to enhance their skills. Healthcare workers based in Luala and its partner facilities, on the other hand, engage ANC clients on early stimulation sessions on play and communication for caregivers.
For Migori County, we started 2016. That is when the national government trained the national trainers. I was one of them, trained as a national trainer in 2016. In 2017, we did another 2. So as a county, we have 3 trainers as national trainers for care for child development. We realized that number was not enough, but we continued introducing it because it is also incorporated in the government mother-child booklets. So through that, we've been having orientation of healthcare workers,
But the real scale-up has come to us last year and last year but one through the support of Wala Community Alliance, where they are really, especially, we are having now Rongo sub-county, which is one of the sub-counties, as a pilot sub-county, because in it all the 11 GOK facilities, okay, the 9 plus 2 private, have healthcare workers trained.
According to Case Foundation, ECD interventions should focus on both long-term and immediate changes in the lives of children. Lola's ECD program integrates immediate services like immunization, NHIF and birth registration with caregiver education and the importance of early stimulation and responsive parenting. Children also get to play using toys created from locally available materials. These initiatives go a long way in preparing children for better outcomes in life.
Greetings all. My name is Dr. Betty Samburu, working in UNICEF. I will be presenting project findings which were conducted in one of the largest agricultural settings on improving breastfeeding and nurturing care practices among working mothers in a Kenyan tea estate. And I'm looking at the role of C4D. This was a collaboration between many stakeholders and it was funded by Bill and Melinda Gates. Work has been identified as a barrier to exclusive breastfeeding, and care for child development is often neglected. 62% of women in Kenya are in the workforce and 52% return to work within 3 months postpartum. Most women stop breastfeeding after returning to work. However, evidence has shown that workplace support program can improve breastfeeding and nurturing care practices. What are the legislations in Kenya to protect breastfeeding rights of women? We have the Employment Act 2007, which gives 90 days maternity leave. The Health Act 2017 has a clause on mandatory establishment of lactation stations. However, mothers working in private sector face challenges because some of them have short-term contracts as a way of avoiding maternity leave, long working hours, lack of flexi time to go and breastfeed, inadequate time, space, and facilities to express breast milk and nurture their babies. There is also lack of awareness of advantages of using company policies on breastfeeding and care for child development. For this reason, in 2016, UNICEF launched a program to improve breastfeeding practices and nurturing care practices in one of these tea estates. The estate has the largest female labor workforce, up to 54%, aged 15 years and above. The main objectives of this project was to strengthen the support to mothers and increase demand for and access to facilities and services that support appropriate breastfeeding and nurturing care practices. What were the methodology we used? We applied C4D processes to design social and behavioral change communication strategies to increase acceptance of and demand for breastfeeding and facilities to promote early childhood development. Formative research was conducted to get the situation and the problem, behavior, participants, and communication channels were identified. Baseline, midline, endline evaluation was conducted. C4D implementation strategy plan was developed with clear objectives as per the situation, and C4D approaches were prioritized using social ecological model. The social ecological model was looking at the immediate beneficiary, who was the mother, and also the influencers, the organizational structure, and the policies that were in place. Training on baby-friendly community initiative was conducted, and youths aged 15 to 30 years were trained as counselors, and implementation of intervention and monitoring was undertaken for a period of around 2 years, and evaluation of impact was done. The following were C4D approaches used: interpersonal communication, group dialogues, and 22 mother-to-mother support groups were established. Bi-monthly baby-friendly gatherings were conducted, and these were majorly to meet the influencers, like the caregivers, employers, and those who are related to nurturing care and breastfeeding while the mothers were away. Workplace dialogues were conducted, like morning master meetings for the workers, and institutional sensitization was done, including consensus building and evidence generation to advocacy meetings. These were the formats used: community-initiated role plays, local folk songs, print media posters, counseling cards, MIYCN videos were put in social halls where mothers will go during their free hours to watch chiefs' barazas, briefing meetings, advocacy park, and demonstrations, for example, cooking demonstrations. Mentorship, monitoring, and feedback review meetings were also conducted quarterly. Stakeholders review meetings and actions were agreed upon, and the mentorship was conducted monthly for the first 3 months and quarterly in the following months. What were the results? The results were 2 daycare centers were established initially at the onset of the program, and the demand for more increased from the mothers. Therefore, additional 3 were added, a total of 5. There was also private breastfeeding rooms within the daycare centers with facilities for washing, expressing, and storing breast milk. 2 breastfeeding breaks of 45 minutes were also given to mothers, and increased maternity leave from 3 months to 4 months. There was enhanced utilization of company policies, some of which mothers were not aware before, and more employers and employees were very satisfied. There was utilization of lactation rooms from 0 at the onset of establishment to around 5 mothers in a month after 1 year. Kitchen gardens were also established around the households to improve dietary diversity. The exclusive breastfeeding rates rose from 20.8 at the baseline to 80.8%. This was a very significant improvement. The partnership also improved because there are other counties which came to learn, and there was also strengthened partnership between many stakeholders who are involved in the project, and this has continued even beyond the project. There was also evidence-based development of policies and guidelines, like the breastfeeding at workplace guideline and implementation framework. In this project, there were quite a number of lessons learned. Internal collaboration and partnership from the start is key. Breastfeeding at workplace in an agricultural setting is feasible, and it is feasible to use young community youths to promote breastfeeding and nurturing care for behavior change. Involve parents and communities in decision making. Engagement of high-level decision makers is key. Make it a win-win, working with county and national government. Social norms and culture can change through evidence-based continuous communication for change. What are the implications of this project? The project presents opportunities to build evidence for baby-friendly community initiative and C4D to replicate in other places. The experience may help expand workplace maternity protection, breastfeeding, and nurturing care solutions for women working in the formal agricultural sector across Kenya and beyond. This project was funded by Bill and Melinda Gates. It was implemented by UNICEF, national government, county government, management in the Tea Estate, and African Population for Health Research Center, I acknowledge all who made it possible. Greetings all.
Good day, dear participants. My name is Fariza Baydale. I'm an early childhood specialist in UNICEF. Today I'll be speaking on the project that was conducted in Samburu and Isiolo counties, which was called Let's Play, Spaces for Kids to be Kids. Before I start the presentation, I would like to thank you. Good day, dear participants. My name is Fariza Baydale. I'm an early childhood specialist in UNICEF. Today I'll be speaking on the project that was conducted in Samburu and Isiolo counties, which was called Let's Play, Spaces for Kids to be Kids. Before I start the presentation, I would like to thank you, our partners who collaborated with us on the implementation of the projects. I would like to thank Women Education Researchers Kenya, Child Fund Kenya, World Vision Kenya, Life Skills Promoters, and Kenya county governments. The project was implemented to enhance early childhood experience and support of marginalized communities to develop holistically. UNICEF Kenya supported Isiolo and Samburu counties to model community-based ECD services through Let's Play, Spaces for Kids to be Kids project. The project targeted 3,500 ECD children under the age of 5, 2,000 parents and caregivers. The sample was equally divided between Isiolo and Samburu counties. The project's main objective was to strengthen community-based integrated ECD with the following key outcomes: improved coordination and management of ECD at national and county levels, responsive caregiver practices for children under the age of 5, and access to quality ECD service for young children from 0 to 5 years. We conducted an endline study at the end of the project. Endline study was guided by the following questions. What are the achievements made towards the coordination and management of integrated ECD? How has the knowledge of child caring practices improved for children under the age of 5? Has there been an improvement in the project ECD indicators? What barriers influenced project outcomes, and what lessons and recommendations can strengthen community-based integrated ECD? We used mixed method approach with both quantitative and qualitative data. The sampling was done randomly, and the source of data included parents, caregivers, school heads, ECD teachers, sub-county reps and officials, project implementers, and health managers and nutritionists. The quantitative data sample size included children, caregivers, head teachers, county health workers, and ECD workers. For most of the targeted population, we were able to achieve more than 90%. With some, like teachers, we even went more than 100%. But with health center practitioners, we were able to achieve only 65.8%, which is 25 people out of targeted 38. For the quantitative part of the research, we covered health center management, Minister of Health officials, nutrition officers, implementing partners, UNICEF project team, and sub-county directors. In total, we targeted 37 participants, and we were able to achieve 38 participants. The sampling for the baseline and endline study were generally comparable. The proportions of male-headed households of baseline and endline study were pretty the same for both counties. The household size was also similar, approximately 6 household members per house, and the proportion of male and female children under the age of 5 were also similar. Finding for outcome 1 revealed improved coordination and management, and teachers spoke positively of the improved ECD services in the county, that the project was relevant to the county needs. However, only 48% of the teachers reported sufficient guidelines for technical working groups, and only 66% of teachers reported that county government supported Ecd Classrooms. Findings on outcome 2 revealed improved caregiving services in both Samburu and Isiolo counties. In general, in both counties, the caregiving practices improved by 20%, and caregivers who received information on good nutrition have increased from 54% to 77%. Caregivers also noted that county has been implemented feeding program in schools, and UNICEF participated in the production of kitchen garden, which increased the nutrition uptake of children under the age of 5. Additionally, County health workers visited households to monitor the growth and development of children under the age of 5. Findings on outcome 3 revealed improved access to quality ECD services. Findings also showed that common stimulations at home increased by 4%, and fathers' engagement in the development of children under the age of 5 also has taken an increase. However, in general, fathers' involvement still remains low. During the course of the project, lessons learned were recorded, and it's important to note that coordination and management plays a great role in the success of any project. Additionally, we would like to mention that adoption of existing structures, government's involvement in mobilization of beneficiaries, including play facilities and materials in ECD, training of stakeholders on caregiving practices, and spreading the impact of ECD plays a great role in the successful implementation of any project. Finally, we would like to give some recommendations on the improvement of ECD services delivery. First of all, play should be made an integral part of any ECD delivery. Secondly, government should be leveraging on the existing practices and structures. Thirdly, government can scale up the project with the support of partners. Collaboration between Ministry of Health, Ministry of Education, and other stakeholders can promote the integrated ECD services. Caregiver involvement is also very important. And finally, the county government can consolidate the benefits of IKEA and UNICEF projects by including budgets and plans for integrated ECD services. Thank you.
The Nurturing Care for ECD program is actually, we are the implementer for the Eastern African region, from Zambia to Ethiopia, Tanzania to Mozambique. We are actually the ones who are implementing it. This program was actually, it was launched back in Harvard, where His Excellency the Governor himself went there, made a visit with a team from the county, and actually this baton of the Nurturing Care was handed over to him, and then he promised to come back to Siaya County and implement it for also all the neighboring counties. So we are actually the county modeling it for Siaya, and for Kenya as a whole, and for the whole of the Eastern African region. Initially, back in 2014, according to the Kenya Demographic Health Survey, it was found that there was high level of malnutrition. Issues like malnutrition, we call it stunting growth, low birth weight were very prominent because of probably issues to do with nutrition, poor visits to the health medical attention, and then poor, we call it responsive caregiving. It was not up to date. So when now the Nurturing Care program came with the 5 elements, that is good health care, good nutrition, security and safety, responsive caregiving, and opportunity for early learning. Now we are seeing that from the campaign that we have been doing, the parental engagement, the so many workshops, and then the which we have been doing in a multi-sectoral nature, whereby we involve every sector from the devolved to non-devolved. We are moving together as a unit in ensuring that this program is implemented.
Siaya County has about 1,000 ECD centers. Now our ECD centers are vast across the county. We have both private ECD centers and we have public ECD centers. Of the 1,041 ECD centers, we have 684 ECD centers that are public. When we come to ECD, we don't look at the education itself, because at this point I am talking about early childhood development in terms of learning, which is the 4-year-old to the 6-year-old. However, when we look at ECD, we look at it as holistic as it can be. A child's development starts from conception to 8 years old, this is the place where the brain of the child develops, and the way the brain will develop will affect the way the child is going to grow up in the future. Now, your child should be looked at in those eyes, because your child is your future. How do you take care of your future? You protect it. So those are the strategies that have been laid out under Nyathi and Mwandu, so that this child will be brought up in a holistic kind of way.
Nyathi and Mwandu is the rallying call. It's in Doluo. That means a child is wealth. If you give that child a good foundation, that child is wealth. And so, being the patron of Smart Start Siaya, I've been a patron for 2 years, following realization and the introduction from the county executives who went to Harvard University for a program on early childhood development. And from Harvard University, when they came back, they realized that early childhood development is very critical in development. And if we invest more on early childhood, then the return on investment is very high. And so we realize that mostly, even us as parents, governments, we don't really take much interest when our children are young. And so we lose a lot, because that is the time a child develops very fast, the brain of the child develops very fast.
This project of SCORE ECD is looking at a child at 1,000 days. 1,000 days means from conception to 2 years. And we look at many things around this 1,000 days. We are looking at the health of the mother during pregnancy and after pregnancy, and then during the 2 years, how is the mother? Then we are also journeying with the child and assessing the milestones of the child. The milestone of the child, we are looking at so many things: health-wise, nutrition, education, the formation of the brain, how does the child react to the environment. Along that, we are also looking at the immunization of the child. How is the child's health going to be taken care of within the 2 years? The child has to go through all the immunization, and this helps the child to remain healthy.
Male partners, we really train them to say that a mother cannot raise a child alone. They have to be two. So there's that responsibility of a father in the house. So fathers, we see them coming to the clinic. They bring their wives to the clinic, their children to the clinic. Whether the mother is pregnant or not pregnant, they come with the mother in the clinic. So it's a habit that they have developed simply for that, and they feel it's just too good for them. If a father is not able to escort the mother to the clinic, a father will provide transport. And the father also is taking a responsibility of reminding the mother, your time has reached. Did you go to the clinic? And
also to make toys to our young ones at home. And these charts, some days we have so many charts that we are able even to give to the community. Those ECD activities at the household. ECD activities which are being promoted by that organization, that is BART, it has encouraged many mothers to come to our facility because they guide us what we are supposed to do. They have taken us to courses, and their routine, they come to this facility routinely to check our ECD.